In order to diagnose diabetic eye disease, it involves a dilated fundus exam looking into the back of the eye. There are two other main tests we do. One's called an OCT, or optical coherence tomography, where we actually can measure the thickness of the retina. The very center of the retina is called the macula, and that's vital for 20/20 vision. In diabetic macular edema, that's when you get fluid accumulation in the macula or the center of the retina. So we can do this OCT. Sometimes I refer to it as the macular scan, that actually shows whether there's thickening in your macula, whether there's edema in the macula. So that's a very vital test to assess whether macular edema is present in these patients. The other test we do is something called retinal angiography, where we inject contrast dye in the arm. It flows through the bloodstream and goes to the eye, and we can see abnormal blood vessels very easily on that test, something we call neovascularization, that gives rise to proliferative diabetic retinopathy, which simply means there's blood vessels, abnormal blood vessels growing in the back of the eye. That is a disease that needs prompt treatment in order to reduce the risk of vitreous hemorrhaging and scarring in the back of the eye. So those three tests, a dilated exam complemented by the OCT as well as retinal angiography, are typically used to manage diabetic eye disease and help in detecting the degree of disease a patient may have. The tests we use in managing diabetic eye disease, the frequency in doing those tests depends upon the advanced nature of the patient's disease. In order to screen patients, typically we just need to take a photograph to see if they have any evidence of disease, or we can examine them with a clinical exam with our instruments. Those that have disease, we typically do an OCT or a macular scan. If their scan is healthy and normal, they probably need one once a year in order to follow their disease. Same thing with the angiogram. Typically, we don't need to get that test until they have more advanced disease and we become concerned with how we're going to treat the patient. So in general, although patients with no disease need to be seen annually, those with disease will often be seen. If they're under treatment, sometimes we see them on a monthly basis, depending upon their disease. Sometimes those patients will be getting treatments with injections in their eye in order to control their disease on a monthly basis, and we'll be getting those macular scans monthly to assess their response to our treatments. The angiogram also, sometimes we'll get them maybe every 3 months, 6 months, depending on whether we're treating this proliferative diabetic retinopathy in order to assess whether they're responding well to that intervention. So it really depends on the particular case, but those tests will be done quite frequently in patients being managed with active disease.